Good afternoon and welcome to our weekly update from the Department of Behavioral Health. We will start, and I think that we're going to have to figure out a way to make the concept that racism is a public health crisis incorporated somehow even more strongly into our mission statement. But we want to continue to keep this at the forefront of our thoughts because we can't really eradicate racism unless we do the things we need to do to eliminate things from our structure that might contribute to it. So you'll hear me continue to talk about it in pretty much all of my presentations. It remains Mental Health Month, and we have a lot of exciting activities coming up. May 15th, I believe, is the Grizzly game, where they're really doing a lot of promotions. If you follow our Facebook page, we reposted their post about mental health awareness, and it was awesome to see. So a lot of good things happening in that regard. All right, we're going to talk about COVID. Last week I asked people to send in questions. I didn't get a lot of questions, so I'm going to go through my usual presentation and then I'll tackle those questions. Worldwide, we have over 160 million cases of COVID and over 3.3 million deaths. We've had a change in how the slide looks like. Johns Hopkins, which is where I get these slides from, has slightly changed the format on their website, and so they're now reporting out vaccinations as well. And it's really remarkable. 1.378 billion vaccination doses have been given worldwide. Really, really remarkable. And then I want you to look on the right side, and that's really just the trends in terms of cases and deaths across the world. So you see we've had some spikes and then some valleys and then a little bit of a spike going on worldwide right now. And in the United States, 32.8 million cases, 583,832 deaths. And if you look on the right-hand side here, you see that we had that winter surge, which was far worse than the summer surge, but we're on a downward trend now. And so that's both cases and deaths being on a downward trend. And we've given 264 million doses of vaccine across the United States. In California, 3.659 million cases and 61,351 deaths. We have given 33,352,000 doses of vaccine. Still working on ensuring that everyone has access to a vaccine. Our overall positivity rate is 1.2% in the state, coming down, continuing to come down. That's a slight 0.1% increase or decrease from last week. In Fresno County, we've had 101,838 confirmed cases of COVID and 1,688 deaths. We are still performing fewer tests, but a little bit of a bump up. I think last week I reported 246 per 100,000 per day, and now we're at about 277. So that's good. We are, it's good to keep that test, the number of tests being done up so that it's an accurate reflection. And I'll show you something in a little bit to kind of describe that. In terms of hospitalization, boy, this number just keeps bouncing around. Just a couple of days ago, it was down to 69. Now it's back up to 81, 17 in the ICU, and only 8 ICU beds available. So if you look on the right-hand side, we're just bouncing up and down, 92, 97, 83. Now we're down to 81, as low as 69, and we'll just continue to see that number hover there. I anticipate particularly because we are not doing significantly more vaccinations, although I'll talk about that a little bit more in a minute. In terms of our tier system, we remain solidly in the orange tier. Our positivity rate unchanged, 2.2%, little lower, 4.3 positive cases per day per 100,000. Our health equity did pop up a little bit from 2.7 to 3.4, so that's something we'll want to watch closely. In terms of what's happening across California, San Mateo and Mono County went from orange to yellow, and Madera County went from red to orange. So one of our local counties finally got out of the red zone. But we continue to have, kind of in the center of the state, some persistent counties in the red. I believe Stanislaus and San Joaquin are in that, and so they're continuing to work hard to get out of the red zone. In terms of vaccines, we've now done 715,486 doses of vaccine. We have 291,141 people fully vaccinated and 101,891 who are partially vaccinated. So awaiting a second dose of the vaccine. So it's encouraging to see that number go above 700. We'd been a little slower. That's nice to see. Additionally, 80.9% of individuals over the age of 65 have gotten at least one dose of the vaccine. That's our most vulnerable population, the population that is most likely to be hospitalized or die of COVID. So that really high vaccination rate is something that we should all applaud and be happy about. So what's happening in Fresno County? We continue to trend downward in cases. Hospitalizations, as I mentioned, are fluctuating, but generally trending downward. While we go up and down, the general trend is definitely downward, as well as deaths are trending downward. And vaccines are now available to kids 12 to 15 years old. This is specifically the Pfizer vaccine. Remember, that's a 2-dose vaccine with the doses taken about 21 days apart. 4 of my kids have gotten the Pfizer vaccine, maybe 5, I can't remember what one of them got. And so the Pfizer vaccine has been approved now for 12 to 15-year-olds. So you'll see a real push over the next several weeks to make that vaccine available for parents to have their children vaccinated if they're willing to. Nationally, we also continue to see that trend downward. And the CDC just today, I love it when they come out with things on the day I'm doing this presentation, has said that individuals who are vaccinated don't have to wear a mask indoor and outdoor for the most part, don't have to do the physical distancing. We do not have state and local guidance on that, so those will remain in place. And I have to tell you, from my perspective, I think it's very challenging to go in this direction because we don't know who's been vaccinated or not. So you should expect to begin to see some decision-making around asking for what someone's vaccine status is and trying to figure out how we would manage that, especially in a workplace setting where we really have an obligation to keep the workplace setting safe, and so we'll have to work through that. I did want to touch on India. I've talked about it the last few weeks, and so I wanted to talk about it a little more. The cases have slightly declined. They were trending well over 400,000 a day. Now it seems to have dipped into the 300,000s, but generally it's felt that the cases are being unreported. So that's something that if you go on the Johns Hopkins website and you look at it, there was one country in particular, I meant to make a copy of it to show you, it was Turkey. And you could see that very few cases are being reported, but their deaths are going up. So to my example, that when you're not testing a lot, you might not really be able to assess the prevalence of COVID simply based on test positivity. And so in India, because their system has in some places collapsed, that may be a reason why the testing has went down. The other thing is that they also believe that the outbreak in India has maybe peaked in the large urban areas where there's a lot of people concentrated, but it's now spreading to the rural areas. So it might slow down, but that doesn't necessarily mean that there aren't people still being impacted by it. The other thing to note is the variant that has been identified coming out of India has been categorized as a variant of concern. And just a reminder, we talked about this previously, any place in the world, any country, any state, any county that has a significant outbreak like what we're seeing in India, where you have a large population and lots of COVID, the chance of variants increase. We do not know right now whether or not the vaccines are effective against the India variant. I do expect that to be tested over the coming weeks, and we'll report on that as we know. And then just a little reminder, because I keep having people tell me, oh, someone who got vaccinated got COVID, as if to imply that the vaccines don't work. the vaccines do not protect you from getting COVID necessarily. What they protect you from is the sequelae of illness, hospitalization, and death that can result from COVID. I think it was announced, in the media that the Yankees baseball team had a bunch of people get COVID who had been vaccinated. Yes, you can get COVID when you're vaccinated. It's quite likely that your case of COVID will be significantly less intense than if you had not been vaccinated, and your risk of hospitalization and death is significantly lower. So when you hear that 95%, it doesn't mean only 5% of the people will get COVID. It means only 5% of the people might be hospitalized or experience some of those more significant illness associated with COVID. If you hear people or you have been vaccinated, you can still get COVID. That's why, we want to still be careful. Why thus far, till today, we've still been wearing our masks and distancing. And, keep in mind that at some point, when the prevalence of COVID is low enough, you might still get COVID, but the chance goes down so much more once everyone's been vaccinated. That's the herd immunity. And, there's some level of risk that we all have in life. We know every year that the flu comes. Some of us choose to get vaccinated, some don't. Some get the flu, some don't, etc. And eventually COVID will be like that, barring some unforeseen variant that has far more significant impact or significantly more susceptibility to it, then we might be in a different ballgame. One thing to note about the India outbreak and the variant is they are beginning to see increases in COVID in the countries surrounding. I talked about that a little bit last week. It's more and more in Taiwan and Japan and Laos and other countries, Thailand and such, that are around India in that Southeast Asian part of the world. And so real close watch will happen in that area to see that higher infectious rate. Does it also result in more hospitalizations and higher rates of death? And so that's always the three things you're looking at with variants are, is it easier to get the virus with that variant? Are you more likely to get very sick? And as a result, are you more likely to die? And so those are the things they watch with each and every variant. And then the next thing they look at is, do the vaccines that we've already been given, do they protect against that variant? So remains to be seen with the India variant. I also wanted to just show you the same information I shared with you for the United States. I went ahead and showed you for India. So if you look at that far right graph, you really see that peak there. And so the next one I'm going to show you really illustrates for you that COVID case comparison, those two graphs. You've got the United States had that peak and it's down, and India is just way up, really illustrating that. All right, other vaccine news. They are continuing to research the effectiveness on those variants. We are seeing widely in the United States a decline in vaccinations. A small uptick is expected with that change to allow 12 to 15-year-olds. We don't know yet how many 12 to 15-year-olds will be vaccinated, but that should show an increase. And remember, anyone that gets vaccinated helps us with herd immunity. And we still have many, many nations with low vaccinations and limited access to vaccines. And very quickly, I'm just going to tell you, I mentioned earlier that the United States, we had administered 264 million doses of vaccine. India is about 4 times as big as us, and they've only administered 177 million. So we would expect them to be closer to 1 billion doses of vaccine to come close to where we're at with the same population, so vaccine doses per population. So they're way behind in vaccination. All right. I asked for questions last week. Didn't get very many, but I am willing to answer the ones that I did get, and I threw in a little information that some of the supervisors shared with me, questions that they're getting. So we have gotten some questions about if you happen to have a job where you go to other parts of the county, other departments, buildings that aren't run by behavioral health, what do you, are they following the same rules? And I'm seeing people who don't have masks on. And in particular, this was raised about JJC. And I did reach out, and they are supposed to be following the same rules. They really are concerned about that. And so I can reassure you that countywide, we are trying to create a standard. If you happen to see something that concerns you, feel free to raise it up through the chain of command, and we'll make sure that it gets to the proper people. And then, the big one is just, when are we going to return to work? And I've been reporting out on this, but I'm going to give you a little additional information in advance. We anticipate on June 1st to give you a lot more detail around a phased-in approach to return to in-office work. And that phased approach likely will involve things like hybrid work schedules for some of you, particularly if you work in an area that has cubicles, or you work in an area where multiple people share an office. We'll likely have some sort of hybrid arrangement. Now, I want to make it very clear, I've said this before and I'm going to say it again. You could be asked to return to in-person work at any time individually based on business need. So coming up with a plan, publishing that plan for all of you to look at, giving you some advance notice does not preclude you from being asked to return to work if we need you sooner. And so I don't want anyone to say, oh, DeJuan said I don't have to return to work until such and such a date. That's not going to fly. That doesn't work. We will, as much as possible, work with you if we have a business need to bring you back, but that could happen at any time. So with that said, we hope to have that plan published on June 1st with an expectation that that plan will be fully implemented by July 1st. Some of you will be hybrid, some of you might be full-time coming into office, and so you should be prepared to do that by July 1st. I definitely got feedback that it's creating a lot of anxiety, not knowing, and so I wanted to at least give you those 2 dates. July 1st will be the plan. It will be a phased-in approach, and again, by July 1st, you should expect, to have that schedule implemented. Now, I will say with the CDC coming out with these new guidances, it might give us some additional information that would reduce the need for hybrid, but we'll see as we go along. And generally, I would say that's what the plan is. Obviously, as I've stated multiple times throughout this, something could change that would delay some of our plans. We might also, like with the CDC publishing new information, it might accelerate our understanding, but we'll try and stick with the schedule that we had said previously. There were also some questions related to pay and work opportunities. And so some of those pay questions, I will remind everyone that coming in June is MOU negotiations between the county and our labor partners. And so I highly, highly encourage you, if you have questions about that, to work with your labor representative to ensure that your concerns get raised in those negotiations. And as far as other work opportunities, I'm going to kind of reserve some answers to those questions to our all-staff meeting, which I believe is scheduled in just a couple of weeks. I'm looking at my phone because some questions have come in, I believe. So someone asked, and this is not an uncommon question that gets asked, about will we be allowed to continue working for home or 4 10-hour days and alternative schedules. I think I've shared this previously. At this point, we don't have plans to implement permanent work from home positions, and that's because it has to go through the county process, and we don't have time to do that before we return to in-office work. And there's just processes that we don't control. And it's the same with alternative work schedules, 4 10-hour days, et cetera. And I know that there's been, a lot of questions about that. We're doing some pilot work with one of our contracted providers, and that's raised questions with our staff. And I want to reassure you that we will explore all of those options as we move forward. We just have to do it methodically. We can't do everything at once. So we will continue to explore alternative work schedules. We'll continue to explore opportunities for remote work, but we're just not there yet. And I really want to emphasize to all of you, I don't know that everyone's aware of this, but we've had some really significant incidents occur with some of the people we serve who appear to be struggling with their stability in this time where we're not doing as much in-office work with them. And so there's a lot of tension right now that we need to be able to provide in-person services when that's needed, that the people we serve are struggling and they need us to be there for them. And we believe we can create safe environments in order to do so. And so there is that tension and that pressure to meet the needs of the people we serve. It's not, arbitrary why we're really pushing to do this, especially when we're seeing all of the markers that we need to see that assure us that we're not in an outbreak, that we don't have a dangerous situation going on, and provided we put all those measures in place, we should be fine. Okay. I don't know what the other question is about, so I'll answer that one later. So anyhow, those are the questions that I got during this last week. I'm happy to take any other questions. I'm going to look over here now. When it is time to go back to the office full time, is it possible that the current Friday day attire dress code continue to stay in effect if we are not in client-facing positions? I think what this means is we kind of relaxed our dress code during the pandemic. What I would tell you is like generally I would say we'll go back to the Friday casual day, but we're willing to look at that as we move forward. Early on, we heard that the vaccine may need a booster shot at 6 months. Is that still considered necessary? We don't know. I actually just heard a news report today from a scientist who's working on this and was asked this very question. We heard it would be every 6 months or once a year. And what this particular scientist said is, at this point, the efficacy of the vaccine seems pretty good. It's been more than 6 months since the trials started, and they're seeing at least more than 6 months of time where people who were vaccinated in the vaccine trials are maintaining the efficacy of the vaccine even now and even through outbreaks. And so we just don't know. It's not to say that a variant or something else wouldn't happen that would create the need for a booster shot, but right now we don't know that there's a need for a booster shot. We're prepared there could be, but we don't know that we need one. So I hope that makes sense in that we could need one, but right now we don't think we need one. All right. And someone else said they're willing to get a booster shot if needed. Me too. I would be happy to get a booster shot if that gave me and my family and my community more protection. I will likely get a booster shot. But I'm someone who gets a flu shot every year. And so that's just kind of in my nature. All right. Other than that, I don't have any other answers to give you, but even though I reserved today for questions, as always, I'm happy to take your questions at any time, more than happy to answer you either via email or at our next update. I will also have a time in our next all staff in a couple of weeks to answer questions. So if there's questions unrelated to COVID, like the questions that came up about pay and advancement opportunities, I will try and answer those questions during the all staff as well. So with that, have a great rest of your week and weekend, and we will see you next week.